Hey, I'm going to show you the 3 best physical therapy exercises if you've got pain and stiffness coming from neck arthritis. My name's Dr. David Midoff, and I'm a specialist physical therapist at Paso Manual Physical Therapy. And this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Please subscribe to our channel so that you don't miss out on any of the helpful videos we upload every single week. I'm about to get into the 3 exercises to get you this relief from your neck arthritis. But if you're not sure if you've got neck arthritis, then you've got to check out our video that we've linked in the description below that covers 5 signs that you've got neck arthritis. If you've never seen a doctor for this, if you've never had an x-ray and have been told that you have neck arthritis, go check out that video right now to make sure that this is the right exercise video for you. Okay, now that we've cleared that up, let's get into the first exercise. It's going to be a double chin neck mobility exercise. Now, I've talked about this in a few other videos, but it is so fundamental to make sure all the bones in your neck, all the joints in your neck are moving correctly by firing a deep core muscle of the neck. So what you've got to do is make a full double chin just like this. Hold it there for about another 5 seconds. And when you do that, you should feel the muscles behind your throat tightening up a little bit. They're right behind your throat, your airway right here, and where you swallow, but not off to the sides. They're not these big muscles out here or the ones further out. They're right behind your throat. So when you do that double chin motion, you should feel them tire out. And this video is going to be focused a lot on these muscles, so you got to get clear on this right now. If you don't, pause here, rewind, and make sure you've got this down correctly for yourself so that you can get those deep neck flexor muscles working properly. Once you find that you can fire those muscles, next you've got to fire them at a smaller percentage. So if you were firing them at 100% when you made your double chin, back off to about 50 to 25%. You want to be at the amount of head nodding or chin position where you barely feel the muscles firing. And just to show you from the side view, it's not looking down, it's shoving your head back and maintaining your head straight, even nodding down slightly so that you can fire those muscles. You're making a double chin. That's what you're doing here. So find out the right position that you need to be in to just barely turn on those neck muscles. For me, it's about right here. It doesn't look like a big double chin at all. It's just a subtle nod with my head moving back a bit. Okay, once you've found that, this is critically important. You've got to get this head position right to get these neck muscles working. Now you can go to the neck mobility movements. So we're going to go through 3 different movements. The first one's going to be side bending. So you're going to hold your chin down just a bit like that. Then you're going to bring your ear to your shoulder. I'm going to go to my right. It doesn't matter which way you start. We're going to do both sides. So chin down, then head over towards your shoulder and go as far as you can. If you want to bounce there a bit, you can. But you're going to do this for 5 reps. Chin down, get those deep neck muscles working, and bring your ear over to your shoulder. Avoid the temptation to turn your head to bring your chin to your shoulder. We'll do that motion in a bit. Just make sure you bring your ear, let me get my chin straight, then bring the ear over to the shoulder. So that's my third, chin down, ear to the shoulder. And last one, and I'm gonna go the other way, chin down. There we go, something popped in my neck. That's what we want here, is for things to free up. I'm gonna do that a couple more times. You can bounce a bit if you feel like you need it. Okay, so I did 5 in each direction of side bending with my chin down to fire these muscles. Next, let's do the same thing with rotation. So chin down, and now you're going to bring your chin over to your shoulder. Just like that. Not your ear, your chin. Chin down, and then rotate. Chin down, and then rotate, and do that 5 times in each direction. So I'm going to go to my left now, chin down, turn left, something popped again. And I feel a little grittiness, like crunchy, like sand inside of my joints. And it's improving as I keep going. It's almost gone now at this point. Yours might never go away. You might feel like it's always there. The hope is that it improves a bit the more you move. And as we go through all the exercises, if you come back to this neck mobility exercise, this double chin mobility exercise, it should be even better as time goes on, especially as you get stronger as the weeks go by. And the last motion that you've got to do is neck flexion. So you're going to hold the chin down and then bring your head down, chin towards your chest, and then come back up. Chin down first, and then look down. 2, chin down, and look down. And for this one, you'll feel like you're doing almost a max double chin at the bottom of the motion. So double chin a little bit, then go all the way down. 2 more. There we go. Now I don't want to go up in that direction at this point. Sometimes it's fine, let me go through it with you because you might find that it gives you relief, but oftentimes for me as a physical therapist working with patients that have neck arthritis, we find that it's not the best thing for them to be doing long term. You just can't keep those neck muscles engaged and look up. So watch, if you start like this, as soon as you start to look up, you give up. So you kind of lose stability. And the reason for this is that the root problem of neck arthritis is often that these deep neck muscles are too weak and the ones in the back are too strong. So if you're going up like that, you're just going to feed into the strong muscles that are already causing the problem. So there isn't really a need to do that. You need to go down and get those deep neck flexors working most. All right, for this second exercise, you're going to need to lie down somewhere. Get on the floor, on the couch, on the bed, wherever you feel most comfortable. Let's go on over. For the second exercise, we're going to do a neck sit-up. Now, it sounds exactly like what it is, but you're going to use a towel, or I've got a big pillowcase here in this case. Now I'm going to put it down on the bed or wherever you're lying down, just like so. And you're going to want to lie down so that your head is about right here and your shoulders and body are down here so that you can kind of pin this down with your body weight, just like that. It's okay if you're not perfectly centered. What you want is for the corners of the pillowcase here to help you out. You're going to be able to grab them to help you do the sit-up motion. So for that neck sit-up, you need to be good at that deep neck flexor activation, the double chin motion. Like I said, it's going to come back. You got to do that double chin first. Grab the pillowcase, holding the double chin. You're going to be looking down and holding right here for 10 seconds. Now what you want to begin to do is offload your hands. So in other words, do less work with your hands. Don't let go completely at first. And keep your chin down against your chest so that you fire these muscles deep in here. So you're going to do 10-second holds 10 times, giving more pressure to your neck and taking less support from your hands. So if you think of it in terms of percentages, right here I'm about 50-50. Half the work's being done by my hands holding the pillowcase up, and the other half is in these muscles, and I can feel those deep neck flexors working pretty good here. So the next rep here, I'm going to do 60-40. So I'm giving a little less pressure from my hands, and it's working more in my neck. And what you should feel too is your abs working. That's a good thing. You should feel your abs are tightening up a bit, but you'll definitely feel it in your neck. After about 10 seconds, and see if you can go more, 70-30, 70% working from here and 30% from my hands. And if you can work your way all the way up to where you're doing 100% from your neck, nothing from your hands, great. But let me just warn you before you keep going. You don't want to feel any increased pain or discomfort besides muscles working. If muscles are working in the front of your neck, great. You shouldn't feel muscles are working in the back of your head and neck. Those are not the muscles you want to work. That's actually a compensation pattern that's feeding into your neck arthritis issue. So avoid that, please. You need to get support from the pillow if you're getting that muscle fatigue in the back of your head and neck. So right here, chin down, I'm about 70-30. It's definitely more work for my neck now. I'm barely holding on with my pillowcase here. Okay, that's 10 seconds. Now let's do 80-20. I'm pushing my chin into my neck. A lot more support from only my neck and minimal from my hands. That's about 10 seconds or so. I feel these neck muscles working. All right, we're going 90-10. Barely even holding on with my hands. Definitely feel my neck working. All right, next we're gonna go 100% for my neck. And I feel it right here. Pretty good, but don't do this again if you feel the back of your neck working. You might feel stretching on the back of your neck. That's different. You just don't want to feel the muscles tightening up or fatiguing in the back of the neck. They should be fatiguing right here on the front, deep behind the throat. And if you feel like you can do all the reps like this, go for it. But what this is doing is strengthening those deep neck flexors because it takes pressure off the joints where the arthritis is in your neck. All right, for the next exercise, you're going to still stay on the floor of the bed wherever you're at, but you're going to get on your hands and knees. Let me show you. So for this one, you're going to get on your hands and knees, and you're going to be getting into the prayer position where you're on your knees bent, like on your haunches, like a cat or a dog would sit, and then you're going to be pushing your hands away while keeping that double chin position, a slight double chin position. You're not going to go a max double chin. And the goal of the exercise, when you hold, because you're going to be doing 10-second holds, you got to shrug all the way while keeping your chin tucked down. So it looks like this. Hands and knees right here. And then tuck the chin down, holding your chin tucked down, sit back, and then right here you should be shrugging as much as you can. I'm trying to push my shoulders into my ears as I maintain my chin tucked about 50%. I feel those neck muscles working, and I definitely feel my shrugging muscles working because I'm shrugged up. If I relax the shrug, it's like this, but if I shrug, then I'm like this. After about 10 seconds, you can come out of that position, and let's do that 10 times, just like that. So hands about right here, tuck the chin, and then I'm pushing my body away through my hands while shrugging my shoulders into my ears to get my shrugging muscles working. Don't lose your head position. I'm keeping my chin tucked down. If it's not tucked down, this happens. You shouldn't be looking up. You shouldn't even be looking at the table. You should be looking kind of between your legs from right here. And rest, and we'll do about 10 of those. I'm gonna pretend, my shirt's getting in my face. I'm gonna pretend that I'm gonna do all 10 here, but I'm gonna cut it short just a bit. You pause it and finish your 10 reps. Because I got a couple more things to tell you regarding neck arthritis and exercises for them. So be sure to watch to the end of the video so that you catch everything. So tuck down, shrug, get a good shrug. You're trying to shrug about 100%. Definitely keep the chin down about 50%. Thanks for doing these 3 exercises with me. Give them a shot. You should feel like your neck should move a lot easier. If you go back to that first double chin mobility exercise, you should feel like your neck moves more freely. The muscles around your neck will also be warmed up. Now, it should not hurt to do these exercises. It should feel better, freeing afterwards. You shouldn't feel like things got stiffer. If that's the case, then you might have something else in addition to neck arthritis going on. You might have a nerve issue. You could have a disc issue as well, and you need to investigate that just a bit more. It could also be that your technique was off on these exercises. Go back and make sure that you did everything just as I explained. And if you've got a more severe case of neck arthritis, your stiffness and pain is just quite high, then I recommend you do these exercises every hour while you're awake. You know, within reason. Of course, you're going to be out doing things, or you might not be in a good position where you can do it exactly every hour, but the more you can stick to that routine, usually the faster you'll get some relief and increase your mobility for the long term. If it's more of a medium case, it's not real severe, but it's also not quite mild, then that would be in a consistent routine of doing this 3 times a day for at least a couple of weeks, or until the stiffness and pain subsides further. Now, if it's just mild, meaning it bothers you still daily, but it's not bad, it's not keeping you up at night, it's not limiting you in your motion quite a bit, then I would do this as needed. When it flares up, do the exercise maybe every day, or even a few times a day, or every hour for a day or 2 while it flares up. And then once it goes away, you can stop doing these exercises. Now, my advice for you long term, if you're feeling great, if these exercises helped you out and you feel like your pain's nearly gone, you've been maybe doing these for a few weeks, or maybe even a few months if it was a more severe case, you need to get stronger, especially with overhead lifting. I've linked a video down in the description that talks about how to do overhead lifting properly, so go check that out if you're at that point in time. And just, this is a bit controversial, overhead lifting. You got to keep this in mind. If you go see a doctor and they find out that you have neck arthritis, they're probably going to tell you not to lift anything up overhead because it's going to make your neck pain worse. But the way that I teach it in this video, it is a proper way with proper neck mechanics. That double chin is really important. It's the right way to get stronger. And if you do that exercise and get stronger over time, then you should get long-term relief from neck arthritis flare-ups. So guys, if you like this video, give us a thumbs up, and don't forget to subscribe so you don't miss out on any of the helpful videos we post every week. Thanks everyone. Bye-bye.